Good afternoon, everybody. Welcome to our weekly summary on COVID-19. Leo Sarkisian, the Executive Director of the ARC of Massachusetts, will be conducting today's webinar on updates, and we especially want to thank the Doug Flutie Jr. Foundation for Autism for sponsoring this important series. So thank you. So Leo, I see that your
Hi, Carrie.
webinar slides are good, and everybody can hear us. So I think you're good to take it away.
Thank you very much. Appreciate it. So I don't need to do anything else, right? I'm just hosting.
Nope, you're
Cool.
good.
All right. And you're going to oversee the chat. Great. Thank you.
Yes. Yep.
Everybody, it's a pleasure to be with you. And we're expecting a special guest today who's going to give us an update after I do a few slides. Jana Rico, who attended a meeting at 11 that might still be going on. Hey, Carrie, if you get a chance, we probably need to send Janet the link for this Zoom call. Of course, I think of that. And let me send you, I'm going to send you the address right now. Sorry about that. Welcome, everybody. I guess there's got to be something that goes wrong every week a little bit to keep it interesting, right? So she's probably wondering how to get on. But they just, the reason that's important is there was a phone call this morning and with the state about healthcare triage. And so would love to give you a short update on that during this call. And I was thinking each week we'll take a different topic and do a little more, and then we can have a dialogue on that topic. So this week, let's just start basically do an update. Let me get rid of the participants thing in front of me and let me make this box smaller. So basically, this is an update on the situation in Massachusetts. As of yesterday, there's 12,500 total cases in Massachusetts. That's more than double in the week. Triple would have been 15,000. So taking 7 days ago to today, that's the number. The deaths, this shows you what a killer this virus is. The deaths are more than 5 times, or almost 5 times, I'm sorry. It's more than 4 times the number last week. So we had 48 people pass away last week. There was 231 deaths. And we should probably take a second of silence for them. And obviously some of those deaths happened to people we know. I don't have all the names. And I know I just got an email from New York State about, 5 people from disabilities they had already knew had passed away. And that's without all the information. And then 6 people that worked in our field that were known to other people who passed away in New York State. So this is one heck of a virus, and it's a very somber time. And then of the people tested, we have about a little more than twice the people tested at this point, almost 72,000 people. And that's a picture of virus over there. This is deadly. So, and I think what I want to emphasize today as part of that, is that we have to take it seriously. That's Governor Baker at the command center outside. We have to recognize the danger inherent in the virus. Got to stay indoors. Caregivers are key for our community, both family and direct care support staff. Each home's practices are key to stopping the virus. So I just want to, special thoughts out and thanks out to all you healthcare and human service staff, families that are hanging in there as caregivers as well. And I just want to also give a nod to Secretary Sutters, who's, working day and night with her team, Commissioner Ryder, Acting Secretary Sy, and all the people that I know, they're trying very hard to keep up with this. And hopefully, we'll have as few casualties from this virus as possible. These are the peak weeks. That's why I posted this slide. And, there's a story in the Globe. I don't have it up, but there was a story in the Globe that was a gentleman who just celebrated his 60th birthday 2 years ago. And he passed away alone in the hospital. So we have to take it seriously, but we also can do things about it. And I just want to pull out of here and show you something that I have open. And I don't know why it's not coming up. Here it is, that I have open. And I just got to move this out of the way to show you guys. There was, on the 25th, the state upgraded the COVID guidance to agencies, and basically set up a new document. In fact, I'm showing you the website where you can find all these things. But I also want to show you the updated document. And what that basically did, on the 25th, they released a caregiver document that really went into details of what you should be doing as an employee, what in terms of treating people in your home. But it also talks about, if you have a confirmed employee, what you need to do, and how to handle it. You see the list here: providing care to residents, and then there's all these different topic areas. So it's a very powerful document. But, and there's always a but, we want to also go more than that. So on Friday, Commissioner Ryder said that EOHHS and DDS and others were working on some more specific guidance, so it can get ahead of this peak. And what I mean by that is, what's going to happen if more people get the virus in homes? How do you handle that? And we're going to maybe talk about that for a few minutes after this slide, as well as some other things we have to worry about. Our advocacy update, from our perspective, these are the things we've been working on most recently. Ensuring equity in healthcare, the Center for Public Representation and other groups put together, started a letter for partners to sign on to. Today at 11, the partners were on a phone call. Has that letter gotten written? I reached out to my colleagues, the Independent Living movement, and Bill Henning in particular in Boston, and Dennis Hafey in particular, just to talk to them about some of the common issues we have as well, and include them in the discussion that was going on. I have to say, everyone's been so collaborative, on this healthcare triage. And includes, I mentioned Center for Public Representation, Mass Association of Mental Health, and other groups that have been, Disability Law Center, let me not forget. I'm forgetting about 12 of them, but it's been really collaborative. And so I just want to emphasize that. And why do we worry about equity in healthcare? Because there'll be decisions made about who gets the right treatment and how much treatment. And then related to that, we believe there's some exceptions that are needed for some of those with disabilities. They need hospital surrogates. For those of you that already know people in the hospital, you know that it's very hard, the communication at a certain point. People are trying, and this is not, healthcare workers are in a tough situation, doctors, nurses, and we respect them. And again, we thank them at the beginning of the slide deck. But we really know that some people have to have someone with them. And then we want to address specific guidance for our homes as the virus is peaking. And we need additional assistance for individuals and families at home. We had sent a memo in last week about that, and we're updating the memo today and hope to talk about it again. One of the issues that came up on an earlier phone call today at the ARC-MAS Governmental Affairs Committee was what's going to happen when a caregiver can no longer care for their loved one at home. What if someone living alone with a physical or developmental disability ends up getting sick and needs more assistance than they have? What's going to happen? And then finally, the other issue has been special education and addressing that. And a letter's going out today, a follow-up letter from Collaboration. They met both on Friday afternoon and Saturday. And again, a great working relationship. And I think later today, there's a larger group meeting. And then on the national front, looking for a fourth stimulus to assist the workforce and families, and of course, personal protection equipment. I can't say enough about that issue and how tough it is. Anyone who's caring for anybody, anyone who's working in a home or his family, you know how important that is. And hopefully that's something that will be addressed soon. It's a national problem. I was just talking to someone, one of the press, and this is probably a good time to mention that, and just talking about how it's got to be addressed federally so states aren't fighting each other or paying extra dollars for the protective equipment. But I know there's homes right now that don't have enough protective equipment or any. So it's a very concerning situation. The other thing I want to give you guys a heads up on, there was one of the news pieces that appeared that had me quoted. They really took me out of context. I think the working relationship's been excellent with the state. We're always pushing for more. You know that. We're always going to advocate harder. We're always going to want more. It's because we have a group that historically, has been marginalized, and we want to make sure we get the best we can for the people we care about. But I thought the Boston Globe article this weekend was a fear article that really did a great job explaining people's fears as they get socially isolated. And that's part of the healthcare equity issue. So I want to go on to the next slide and see, is Janet, I don't know if Janet's had a chance to get on or if that other call is still going. But I can talk to you about some of this stuff while we wait for her to get on. And I can also take some questions about the slide deck so far. If people have questions, you can raise your hand. But I'm looking to see how you can raise your hand, Kerry. How come I'm having trouble figuring that out? Sometimes I can see that hand raising, but if people want to chat questions over, I'm going to look at the chat too, if I can find it. And then see if we can, okay, it won't let me send to Janet. Interesting. Okay, we'll email Katarina. Okay. So if people have questions, let me talk about the healthcare equity a little bit while we do this. In terms of what we're worried about. Oh, I'm going the wrong way, sorry. Let me just close this box up. So, I don't know if any of you have heard, but there's two states, Washington State and Alabama, that ended up making rules that would be prejudicial against the people we serve. So the ARC joined an action filed by Center for Public Representation and self-advocates in those two states to question, their process. It was a documented process that was actually discriminatory. Simultaneously, the Office for Civil Rights sent out a guidance, and all we're asking for in Massachusetts is to make sure there's a guidance. So if someone with a disability goes into the hospital, they're not automatically discriminated against based on their disability. And then I'm going to skip to I don't know if any of you, want to share your situation or stories of what's happened in terms of experiencing people going to the hospital and not being able to communicate with them. But that's really concerning because sometimes people need other people to explain what their pain is about or where they're having symptoms, and not having that additional assistance is a real problem. In terms of the guidance for people in homes as the virus is peaking, let me touch on just a couple of things there. One really big problem with that is that if you have two people in one home that have the virus, three people that don't have the virus, are you going to be able to manage that in a house? Should we be thinking about people temporarily moving to live together with people in homes? And that might require some providers working together, where you could have a house that's all positive virus and a house that's all non-virus. And then you could even potentially have staff who have a mild case of the virus still continue to work in the house, be quarantined together. That may seem far out, but if this virus peaks, if a week from now we have 500 people with the virus spread out, or 1,000 people across our service network, it's going to be something to think about. The other big deal is the governor's saying that our staff in our field, we become healthcare workers. The reason that was very important is because up until then, if staff person worked with someone who was positive with the virus for more than 15 minutes, some of the organizations had been told that staff would have to be in quarantine. And they were given different days. Some were given 7 days, even though staff person themselves was just working with the person. The issue became that, I'm sorry, 15 minutes, that's the break period. And you're going to have to basically be quarantined because that person you were helping for 15 minutes does have the virus. So having them be called healthcare workers avoids that rule kicking in and basically allows them to continue working unless they start to show symptoms and show signs of being positive for the virus. So those are some of the specific things. This morning, the call was with Department of Public Health and the Attorney General's office. And the goal with the call was to get the safeguards built in, okay? And to also make sure that we could make it. We also wanted to talk about that exception as well, if we could. But it was going to be about healthcare settings and triage and those kinds of things. So Carrie, I'd like to open it up for, since we're having trouble. So, I think the call probably went over, is my hunch. And we can report on the call later today, but with an update and have it come up tomorrow on your session as well. And your session, you may have a special guest tomorrow, by the way, at 11 o'clock. We
Okay.
may, I'm not 100% sure, but we may have Commissioner Ryder on the call.
Awesome. All right. So Glenn does have a question. Has there been any discussion about giving families additional PCA hours during this time?
So thank you so much, Glenn, for that. So last Monday, we sent in a letter on that and asked for, right now, if you have PCA, you can gain additional hours. But let's say you or your son or daughter have behavioral issues that don't require enough physical prompting, physical help that you qualify for the PCA program, then you can't get, right, the additional funding except through DDS. So we're requesting that that there'd be through an alternative waiver that personal assistance could be provided where prompting or cueing would be included. And it's you can imagine with everything else going on, it's hard to have that discussion, but we're hoping we could have that discussion this week and get things moving on that. So we're updating that note today as we speak to also bring up the issue that one of our members brought up is what happens if a caregiver can't provide care in the family home. And I'd include an individual who's getting assistance that doesn't have enough care. What do you do when they get tested positive? What kind of strategies can we have? Shelters and shelter situations. And but right now, if you or your family member is eligible for PCA services and you need more hours, there should be no barrier getting more hours.
Okay, thanks, Leo. And then Inga had a question. I hear a lot of talk about adding PCA hours, but what about the families on adult family care? Is there any talk about increasing the daily rate? Right.
Well, that's where it would help to have a strategy through the waiver for additional support during this tough time, Inga. So, maybe we're not specific. We'll have to look at our note to see if we're specific enough in our note about that as well. Thank you for raising that.
Okay, and then Glenn did have another comment about the PCA hours increase. My son is physically disabled. Whom at the Northeast ARC should the parent caregiver contact? By the way, your team's been great. Thanks, Glenn.
Thank you, Glenn. So if your son's already getting PCA services, you would go to your personal care management, if that's Northeast, and say that you need more PCA hours. And then basically, now if you're already at a significant max, that's probably not going to happen, but let's assume your hours are like 20 hours a week. Okay, I'm making that up, okay? I would think you'd be in a position to get more PCA hours. But again, it has to be justified on the care you have to give, Glenn, okay? Or for yourself, Glenn, if you're the person receiving the care.
All right, thank you. And Anne raised her hand. I'm asking her to chat in the
Hi, what about
question.
people that don't need PCA service but would like some type of support? With all this going on, it also raises a lot of emotional problems where people just need some type of support.
Right. Great question, Ann. I'd say there's three strategies for that. I mean, one is if you're tied into the service system, I would really recommend reaching out to either your service coordinator or family support center, because they are supposed to be responding, you know. And if obviously someone's in a day program, which you're not, they would reach out to the day program and say they'd love to have some, they're probably not going to get a physical visit, but like virtual visit. Depends on the individual, what they need, right?
Right.
And the other thing would be with social distance visits. So I know that in some residences, what people did in one agency is they actually allowed a family member to take a walk with their loved one during this anxiety full time, and they just kept the social distance. Staff was with them on the walk. And that's pretty cool. I think that's a great example. In that case, a parent was available for that person. The other strategy, so if people are not eligible through DDS to use the Family Support Center or access that kind of support that way, you know, I'm going to put a plug in for our friends at the Independent Living Centers, friends at Mass Families, help you connect to a local chapter of the ARC, and see if people would connect locally. And I think as this goes on, we might have to think about some kind of network, right? For personal, just not necessarily in group talk like this,
Right.
but a chance for some personal talking. So sounds like something to add to our
Like
list.
right now, it's a very unusual time, and I can't use my support person because she's in quarantine. Her son came back from New York.
Right. So one strategy I'd have where you know that person, like in your case, hey, can we have a call a couple of times a week and yap, you know? And but I agree with you that we should have a strategy for that. And I'm going into my phone to write it right now. In fact, actually, I'm going to write it on the computer here because you guys can still see me even if I can't see you when I do that.
Okay. All righty. Yeah, that was a great question, Ann. All right. So, Leo, Lisa has a question. Her brother's in a group home, and her understanding is that staff are all wearing masks. A couple of weeks ago, a housemate was taken by ambulance to the hospital. My understanding is that he had pneumonia. He recovered and is back in the house. We don't know if he was ever tested for COVID-19. And because of HIPAA, a lot of questions aren't answered or basically evaded. Any guidance on a situation like this? If you answered this already, I may have missed it, but we are also concerned about staff working at multiple.
Right. So some agencies right away are not having that. Some are continuing to have that. So first place, you're worried that they didn't take proper steps when this person came back. Do you have a relationship? I guess I would call the program director, you know, and or someone a little further up and just say, I just need to know that, you know, you're following the procedures. You weren't on earlier. I posted, I'm assuming you weren't on. I shared a document that's on the Mass Health site that we're going to put a link to. I thought it was already up there, but it's a March 25th update of caregiver responsibilities. And it does talk about employees that tested positive, what the procedures are to come back. So I just want to emphasize that that's already in place from the state, a guidance from the state. What I also said in the beginning is we're trying to advocate for a more specific guidance for smaller homes as well. Hopefully that answers most of your question. Obviously I can't, you know, we've got to hope that agency complied. And if you want some extra security, if you have an email address or you have other information to contact them, say, I'm hoping you're following the caregiver advice. We're nervous because one of the staff did have the virus. And also know that, you know, a group like a disability law center is still trying to do monitoring of homes and apartments across the state. And obviously it's different when you do virtual and follow-up monitoring, but there are expectations that agencies will follow the guidance properly. That's not to say, you know, you're right to be fearful in that sometimes some people are knuckleheads or they don't know they have the virus, it's going to enter that way. But the people that, you know, it would be the rare exception that someone wouldn't go through the proper clearing process to come back to work.
Okay, thanks, Leo. Nancy has a question in regards to the stimulus bill. if you care for an adult child who you receive child support for and are head of household, what are you eligible for? The adult child is not receiving SSI due to child support.
Does the adult child receive Social Security and not SSI?
No.
Okay. So, but it's an adult child. You're still receiving child support. Wow. In terms of caregiver benefit, right, is what you're asking. How does that play into it? I'm going to have to get an answer for you and put it on our, how do we normally do that as a follow-up, Kerry? So they'll know where to look for it.
I can email everybody who registered for the phone call today.
That's how we'll do it. So we'll have to document. You have it in writing there, right?
Yes.
Yeah, I'll have to get it from you and share it with Nicole or Ellen Taverna to share it with Nicole and just see if we can get an answer. It's a little more tricky question. So I'm at a loss because.
Yeah, Nancy said she's been trying to figure it out too, but she hasn't been able to figure it out. So your guidance will be very helpful.
Yeah, you and I were talking earlier, or emailing earlier, about the confusion potentially is that if people are on Social Security, you are going to get automatically that check from the government in that case. And I know that's not what she's asking about, but people on SSI and VA, they have to actually do the form. It's on the IRS site. And then there's the issue of if you're dependent on someone's taxes, you're not going to get the check as a person with a disability. So really these things are complicated. So there's yes, if, then, but, well, things that we have to find out.
Okay, great. Anybody else have any questions?
I'm going to assume we didn't get Janet because of my job.
Yeah, I sent her. Katerina sent me a link and I emailed it to her. So
okay.
She probably was still on that other call. I imagine it was a lengthy one.
Yeah, it might have gone, no question, it might have gone over, and I'd have an email from her and I don't. Look, everybody, hang in there. Today's a new week. These are the weeks we really are worried about. I want to thank the Doug Flutie Junior Foundation for their support this week. This is our schedule for the week. And this is the website, and will be updated continually with links. And thank you for your support, and we appreciate everybody's support. Thanks a lot, folks.
Thanks, Leo.
Okay.
Thanks, Terry.
You're welcome. Thank you.
Thank you so much.
Thank you.
Take care. And be safe.
You too.
Weeks. Yeah. Take care.
Thank you.